Hello, good day to all. This is Meraj for you, and today we are going to learn about anatomy of the testis. That is the main external genital. That is one of the major genital organ which has many functions, and especially testosterone is made and secreted from. Don't see all these things. When I am going with shape, you have to focus only here. You don't need to concentrate on these things. Okay, when I say only, then you have to concentrate. That is a good way of learning. So now let us go through shape. Shape is oval and ellipsoid. Here see, you see shape. This is either oval, we can consider it, or ellipsoid. The most important thing here is compressed from side to side. Why I am saying this is most important, compressed from side to side? Because when it is compressed from side to side, the only compressed compressed from side to side, it can have upper pole, lower pole, and as it is compressed from side to side, it will have anterior and posterior borders. When it has anterior and posterior border and upper and lower pole, the remaining surfaces are only two surfaces. This is the medial surface, and the behind this will be the lateral surface. So when you remember this point, compressed from side to side, you can easily relate to external features. That is, it can have upper lower pole and two borders, anterior and posterior border, and two surfaces, lateral and medial. So that is how we have to relate the things and connect to them so that we can remember, and we may not confuse it. Can Do testes have anterior surface and posterior surface, or anterior borders and posterior border? So we when if we learn without connecting the things, we will be confused and we cannot recall in examination or doing MCQs. So we have to relate the things. That is the new technique. That is a technique of learning things and remembering for a longer time. Now let us go with the position. Upper pole is slightly forward and laterally present, and lower is backward and medially. But I don't think has importance very much. Just we have to remember. And when we come to borders, anterior and posterior borders, its relation with tunica vaginalis is very important. Now this term has come, new term, that is, what is tunica vaginalis? For this we will go here. So what is the tunica vaginalis? Tunica vaginalis is the persistence lower portion of the processus vaginalis. Processus vaginalis is embryological structure which will be present in the pelvic region, and this is a peritoneum, a fold of peritoneum, pouch of peritoneum, or a tube of peritoneum, which comes out from the same inguinal canal from where the testis is coming, and it also helps in descent of testes, and this processus vaginalis, and this will come along with the testes to the scrotum, and there it will go. It is a pouch, so it will go and it will form like this, and here the upper part of this process vaginalis will be obliterated. When you go and learn the embryology, you will understand, but the lower persistence part will be forming the tunica vaginalis. Let us go and see the diagram. Now focus on only here. What I am saying, only focus on those. Don't need to focus on all these things. Concentrate what I am saying. So here this is the processus vaginalis, that is covering the testes. So this is the process vaginalis. As you are seeing, it is a pouch. When you balloon, it is a balloon. Consider when something is, when balloon So this is the balloon. So it will be having like this. You have understood this careful. I hope you have understood. So this is the way he is covering the testes. This is the way it is covering the testes. So there are two layers, closer to the testes and away from this. So it is named as visceral related to viscerana. So this is visceral surface. The outer it is named as parietal surface. Similarly, as we name the peritoneum in the pelvic, in the body cavities, which lines the body cavities. So this is called the tunica vaginalis. Now you have understood what is tunica vaginalis. It is over. So what is the relation with borders? Is anteriorly it is complete and posteriorly it is not complete. You see here, this is the left testis, this is the medial, and this is the lateral surface, anterior and posterior surface. So you have seen that anteriorly it is completely covered, but posteriorly it is not completely covered. That is the relation what you need to remember. So I was focusing on. Now let us come to the surfaces. Surfaces, there are lateral and the medial surfaces. Lateral surface is what is the some one important structure that is related to the lateral surface of the testes is sinus of epididymis. Epididymis, sinus of epididymis. You know what is epididymis? That will connect to the vas deferens and vas deferens to the uh, to the that is the ejaculatory duct, and then to the outside to the urethra, that opens into the urethra. So epididymis is, you know what is epididymis, but what is sinus of epididymis, that is important. So what is sinus of epididymis means, when you go and see here I have named. Don't focus on anything else unless I mention this red mark. Just take only focus on those things and concentrate totally on my speech. So sinus of epididymis, here you are saying the mark is here. So as we have said, this is the lateral surface of the test, this is the testis. To the lateral surface, it is one important structure related is here, sinus of epididymis, and you're seeing that this is continuous with the processes tunica vaginalis. It means sinus of epididymis is related onto the lateral side of the testis, lateral surface, lateral side, lateral surface, and here epididymis is separated from testis by extension of cavity of tunica vaginalis. So sinus E means it is the extension of cavity of tunica vaginalis. It is the extension of cavity of tunica vaginalis which is separating the epididymis, which is separating the, this is the epididymis, this is the epididymis. It is separating the epididymis from the testes. This testis and this epididymis. These two are separated from the extension of what? Extension of the tunica vaginalis cavity on which surface? Lateral surface. That is important. We are studying the surfaces and their relation. So this is the most important relation on the lateral surface. Both are slightly convex. And medial surface, there is no important structure what I am going to explain, but the common structure for those both are convex surfaces. Now let us go to the coverings. What are all the coverings which are on these testes? First is tunica vaginalis. Second, we'll be studying about the tunica albuginea, and next the most innermost, the tunica vasculosa. So now let us focus on tunica vaginalis. Don't focus on all these things, don't try to see those diagrams. What I am saying, focus on those things and concentrate on my voice speech. So process tunica vaginalis is already done. It is extension, the persistence lower part of the process vaginalis. As process vaginalis is also a peritoneum fold, it is also has parietal and visceral layers. So next is tunica albuginea. What is tunica albuginea? Tunica means covering. So thick, dense fibrous tissue. Thick, it is a dense fibrous tissue. It is a thick and also a dense fibrous tissue, except at place of direct contact with epidermis. It is nothing but a thick fibrous tissue that is covering genia, tunica albuginea. Here this is the tunica albuginea. Between this red line and this tunica vaginalis, this is called tunica albuginea. Just that is simply, that is a fibrous tissue that is covering the testes. So you have seen that. And now let us go to tunica vasculosa. What is this except at the place of direct contact with the epidermis, that is posterior superior. So posterior superiorly, the direct contact of epidermis, where there is direct contact of epidermis with the testes, there it will be not present, there it will be absent. Testis direct contact, whenever there is a direct contact, posterior superior, this is, we cannot see here the posterior superior surface because we have cut this, we have cut it, superior surface will be so if the testis is like this, we have cut here and we are seeing this cut. So that this is the testis, right? We have cut here like this and we are seeing this structure as this. Okay, so superior cannot be visible, inferior cannot be visible, only anterior, posterior, lateral and medial can be visible. So posterior superior, this is the posterior superior, where there is a direct contact with epidermis, there the tunica albuginea will be absent. That is only the thing. And now next is the tunica vasculosa, formed by the medial and lateral branches of testicular artery. Vasculosa means vessels, no? So it is by the testicular artery, is lining the lobules. So here you can see this artery is a testicular artery. Okay, this is dividing into lateral and the medial and anastomosing. So and giving branches, arterial branches. Now you see all the structure is named as it is covering the testis. We have named that as tunica vasculosa. Anatomy is just, you need to know the structures and you have to try to name by yourself what name you can give to those structures and compare it with your textbooks. That is how you have to easily, you can remember that you also, your brain will also confine the naming and nomenclature, and you try to name the structure. That is where the curiosity of the person is seen. So next let us go to the structure. Mediastinum testis. Incomplete vertical septum or ridge in tunica albuginea. Posteriorly, it is posteriorly. Mediastinum testis is present on the posteriorly, and incomplete vertical septum in the tunica vaginalis is known as a mediastinum testis. That we'll see here. Mediastinum is incomplete vertical ridge on the posterior. This is the posterior surface, right? So here the incomplete vertical ridge is known as mediastinum testis. So here you need to know that testis has 200 to 300 lobules, and these lobules, how are these lobules formed? Means tunica vaginalis, this fibrous tissue will enter inside and divide the testis like this. Here you will see this is the tunica vaginalis, right? This chocolatical, this is dividing the testis, right? Dividing into lobules and covering. So it will divide into lobules. How many lobules are present? Nearly 200 to 300 lobules in each testis, and each lobule will have 2 to 4 seminiferous tubules. And now we'll go to the structure now. From here, if in seminiferous tubule the testis, the sperms are produced. and here the sperms will be released into um, so let us know. So in seminiferous tubules, these are lined by thick multi-layered germinal epithelium. So sperms are not produced by seminiferous tubules, but they are produced by the thick multi-layered germinal epithelium. This germinal epithelium will be changed into spermatozoa, and these spermatozoa will en- will enter into straight tubules. There are straight tubules, and these straight tubules will, from the straight tubules, the spermatozoa go into the retetestes. Here is the retetestes. Mm, this is the retetestes. This is the retetestes. From straight tubules, seminiferous tubules, they form the straight tubules. Then into retetestes. From there, they go to the, from here they go into the efferent from efferent to go into the lobes of epididymis. Lobes of epididymis. Epididymis can be classified into head, body, and tail. So this is the head, body, and tail. Then the epididymis, duct of epididymis will be present. So see, now you can relate with the diagram. Here the body of the epididymis. This is the ductus deferens. So from straight tubule, from retetestes to efferent ductule, then epididymis, then head, body, and tail of the epididymis, they go into the ductus deferens. You need to know one more thing, that one seminiferous tubule is equals to 60 centimeter will have length. So now let us come here. We have learned this. We have fibrous septa, that is Tunica albuginea is also fibrous. So this we have learned efferent ductules, seminiferous tubules, and epididymis we have seen, ductus deferens we have seen, and all these are done. So this is the way I teach, and I also learn in this way through diagrams and practice these diagrams. When you learn, you have to draw and practice in your notes while you are learning, so that your brain will try to, when you draw the diagrams, your brain will say you what structure should be present here, why not here, why not here, why not here. So what is anterior, what is posterior, all those questions will be raised when you draw and put your pen on the paper. Unless you do that, just passive reading, just reading the textbook without presence of mind, that will not be beneficial. Active, be active reading. How you have to do active reading? Take notes and start drawing, and try to explain to others when you learn, or speak to yourself and teach to yourself while reading. So just don't read passive reading, be active. Okay, we can relate this anatomy part with some clinical knowledge, with clinical case, which is the ultimate goal of studying anatomy or any subject. Because as a doctor, to become a doctor, we have to have all this knowledge with us, so that it is easier to correlate our knowledge, or our knowledge to learn and understand the diseases. So all those things are important. Now let us go to the, what is testis. Here, important point, testicular arteries arise in the abdomen, and the testicular veins drain in the abdomen, and the testicular lymph vessels drain in the abdominal lymph nodes. This is because during development, all these are abdomen, 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 but the testis is present in outside the abdomen, outside abdomen, that is in the scrotum. Why? Why? Because descent of test. So this is because during development of testis has migrated from high to the posterior abdominal wall, high up onto the bed, down through the inguinal canal to the scrotum, dragging its blood supply lymph vessels along it. That is the reason why it's so blood supply is helping us to understand us and proof for descent of testes. Now let us go to clinical marks. Clinical correlation. So here is a hydrocele. Hydrocele is the accumulation of fluid in the tunica vaginalis. Now again we have come across the tunica vaginalis. We have already learned very deep. It is the persistent lower part. Okay, now this is the tunica removed by the, and this is the accumulation in this tunica vaginalis. This causes this fluid in tunica vaginalis. This is the testis and this is the epididymis. So anterior border, it is completely covered by tunica, and posteriorly not completely covered. Here also we can relate that anatomy. So here it is fluid filled, that is the reason it is called hydrocele, liquid seal filled. So here deep inguinal ring, this is a superficial inguinal, deep, from superficial to deep, this has come. Here the remnant of process vaginal, this dotted structure what you are seeing, it has also come along with this testis descent. But I said the upper portion is obliterated, but the lower is persistent. This obliterated is the remnant, and this is the tunica vagina. So this portion is filled, liquid filled. So this condition called hydrocele. What is the treatment for this? Treatment means it can be removed by trocar and cannula, that is the instruments, and that can be pierced through the scrotal sink. So while we pierce through the scrotal sink, what are the structures which will come across? How, when we pierce from here, what are the structures that are being pierced? We will learn here. First is the outermost is the skin, then the dartus muscle, okay, and then the external spermatic fascia, and the cremastic fascia and muscle, the internal spermatic fascia, and the parietal. So if we learn like this, we cannot learn this, we cannot remember. So how we have to remember this? We have to go and study the descent of testes. While we will learn about the descent of testes, we can easily relate to the layers of testes. So we will learn them. For the sake of now, you only I am explaining. You can learn like this. Here is the external spermatic fascia, the internal spermatic fascia. These are two fascias, and between them is the cremastic muscle along with its fascia. Between there is the cremastic muscle along with fascia. Here is the external spermatic fascia, internal spermatic fascia. Between them is the cremastic fascia and its muscle, and outermost is the dartus muscle. And generally what we will be present inside will be the parietal layer of the tunica vaginalis and the perivisceral layer. But here is the fluid is filled here. We need to remove these, means we have to pierce this external, first daughters, skin, then daughters, then the external, then the cremastic, then the internal, and then the parietal layer. Here, this can be bring out with the syringe and all those things. But so that is how you can do. So next we'll go to our next. So here you can see here is the skin, in the external somatic fascia. Here is the cremastic muscle and the fascia. Then this is the internal spermatic fascia. This is the cremastic fascia muscle. This is the external, and this is the skin. And this is the innermost is the parietal and the peridivisory layer. So here fluid is filled in case of hydrocele. So okay, now let us move. This is also done. Now let us go with the arterial supply. Don't focus on this and explaining this. Focus here and concentrate and be present of mind. Don't look here and there and listen to my voice and speech. So here is the most important is the testicular artery. But from where is this testicular artery is arisen? There are many: abdominal aorta or internal iliac artery or the external iliac artery. If internal, what anterior branch or posterior division? Which division from it is coming? So not all this. So that is the question you have to get your mind. The testicular artery means which it is branch of which major artery? That is the question you have to raise in your mind. Then you can find your answer in the textbook that it is the branch of abdominal aorta. But at the soon you have to get the question that at what level, that is also important. You need to raise your question very quickly. Then the answer will be that it is present at L2. Then at the level of L2 in the abdominal class I will explain all these relations, how we need to learn. So now let us just remember that is at the L2. It passes down from L2. It passes down and laterally. Down and laterally. Then with the deep inguinal canal, then the superficial inguinal canal. In the deep inguinal ring, sorry, it is not deep inguinal canal, it is deep inguinal ring. In the superficial inguinal ring. So these two, in between this, what is the inguinal canal is present. So with the spermatic cord, testicular artery is also going, and here at the posterior border of testes, it will reach the posterior border of the testes. The posterior border of testes. Here the medial, it will divide into two branches, lateral and the medial branch, by piercing the tunica albuginea. It will pierce the tunica albuginea and then divide into lateral and medial branches, and then it will form the tunica vasculosa. That will ramify on the lobules, means it is forming, right? This is ramifying on the lobules. Next we'll go with the venous drainage. Arterial means then the venous drainage. Oxygenated blood is supplied to the testes. Now deoxygenated blood should be removed, right? If not, it will cause the hypoxia and death of the tissue. That is the physiology. In classes of physiology we will learn that, all those things. So here the venous drainage is mainly from the plexus of veins. Pampiniform plexus, the name is pampiniform plexus, just you have to remember that the plexus of veins, this will form into 4 veins. Here this is the pampiniform plexus, then it will form into the, all these plexus will form into the 4 condenses to form 4 veins. At what level is important? At superficial inguinal ring, it will form condense into 4 veins, while at the deep inguinal ring it will condense into 2 testicular veins. So each side there are 2 testicular veins accompanied by testicular artery. One testicular artery accompanied by 2 testicular veins. 2 testicular veins on each side. So then what is right and left side? This is the right, this is the left side. Right side, they test draining into what? Right testicular vein is draining into the, this is what is the major vena cava, inferior vena cava. Right is draining into the inferior. You have to remember the testicular veins are not draining into both into the same, they are differently drained. Right is drained into the inferior vena cava and the left is drained into the left renal vein. That is most important. This is the most important thing. And at the same time you have to know the angle by which it is draining. Here it is acute angle, obliquely acute angle less than 90 degrees is called acute, that too obliquely it is draining. But the left testicular artery is draining at 90 degrees with the left renal vein. So that is what is important of this studying is we have to relate to the clinical knowledge. Clinically it is very important to know that varicocele, it means pampiniform plexus become dilated, tortuous and elongated. Pampiniform plexus is related to the pampiniform, they become dilated, tortuous and elongated. In that condition we call it as a varicocele. The reason can be many things. So here is varicocele should be remembered. Dilated, pampiniform plexus, tortuous and elongated. So most common, this pampiniform varicocele is most commonly seen on the left side. Why left side? Then you will have to know that the relation of left testicular vein, the course of the left testicular vein, then you can answer it. The reason is left testicular vein drains at the 90 degrees, so it has high venous pressure. So the venous pressure will be high as it is draining to, so the pressure from the left vein will be high. On the high venous pressure is present as it is 90. As it is obliquely, the pressure is not high, just low pressure. Here is a high pressure, so this is a high pressure. Or why I said course means constipated sigmoid colon. Why is this constipated sigmoid colon causing is leading to the varicocele dilated? Because this constipated sigmoid colon is related in its course, it is related to sigmoid colon. When this will be constipated, it will compress the left testicular vein, so it will lead to the varicocele. Get understood now? So constipated sigmoid colon or blockage by malignant tubers of left kidney is also present, right? That can malignant tumor can also compress, so here it will be dilated. Now let us go to lymphatic drainage. Lymphatic drainage is mostly into the pre or para-aortic lymph nodes from along the vessels, testicular vessels. See here, you can blood vessels. See, these are the lymph vessels, and this is the vasa differentia, and this is the artery to the vasa differentia. This is the pampiniform plexus, anterior groove, posterior groove, epididymis, testis, testicular vein. Whenever you study the artery, you need to question what I said. Which branch of which major aorta? So artery to vasa, which branch you need to learn. So in our next class I will be dealing with that. Actually, it is a branch of inferior vesical artery, that is a branch of abdominal aorta, that is a branch of inferior vesical artery. This is branch of anterior division of internal iliac artery. So this is all, and this will give a branch to artery to ductus deferens.